I bet you didn't know that colorectal cancer is a growing concern. Understanding colon cancer prevalence. Colorectal cancer, often referred to as colon cancer, is a serious health concern. It is the third most common cancer diagnosed in both men and women in the United States. This type of cancer affects the large intestine, which is a vital part of the digestive system. The colon, the main part of the large intestine, is responsible for absorbing water and nutrients from food. When cancerous cells develop in the colon or rectum, it can disrupt these essential functions. Colon cancer often begins as small, non-cancerous clumps of cells called polyps. Over time, these polyps can develop into cancer. The alarming statistic is that colon cancer is a leading cause of cancer-related deaths in the U.S. This makes understanding the disease, its risk factors, and prevention methods crucial for everyone. Section 2. Who is at risk? Identifying the potential threats. While anyone can develop colon cancer, certain factors can increase your risk. Age is a significant risk factor, with the majority of cases diagnosed in people over 50. Family history plays a crucial role. Having a close relative with colon cancer increases your likelihood of developing the disease. Certain genetic syndromes like Lynch syndrome and familial adenomatous polyposis, or FAP, can significantly elevate your risk. Lifestyle choices also heavily influence your risk. A diet low in fiber and high in red and processed meats has been linked to an increased risk of colon cancer. Obesity, physical inactivity, smoking, and heavy alcohol consumption can also contribute to its development. Additionally, individuals with certain medical conditions, such as inflammatory bowel disease or IBD, are at a higher risk. Section 3. Unmasking the enemy. Recognizing the symptoms. Colon cancer often doesn't present noticeable symptoms in its early stages. However, as the disease progresses, several warning signs may appear. These can include persistent changes in bowel habits, such as diarrhea, constipation, or a change in stool consistency. Blood in the stool, either bright red or dark and tarry, is another alarming symptom. Abdominal discomfort, including cramps, gas, and bloating, that persists or worsens should not be ignored. Unexplained weakness and fatigue, as well as unintended weight loss, can also be potential indicators of colon cancer. It's important to remember that these symptoms can be caused by other conditions, but it's crucial to see a doctor for a proper diagnosis if you experience any of them. Section 4. Early detection is key. The importance of regular screenings. Regular screening is the most effective way to detect colon cancer early, when it's most treatable. For people at average risk, screenings typically begin at age 45. These screenings aim to find and remove precancerous polyps before they have a chance to turn into cancer. They can also detect colon cancer early, when treatment is most likely to be successful. Several screening methods are available, each with its pros and cons. Colonoscopy is considered the gold standard, as it allows for the examination of the entire colon and the removal of polyps during the procedure. Other options include stool-based tests, such as the fecal immunochemical test, or FIT, and the fecal occult blood test, or FOBT, which detect blood in the stool. Sigmoidoscopy, which examines the lower part of the colon, is another alternative. Your doctor can help you determine the best screening options and schedule based on your risk factors and preferences. Section 5. Staging the battle. Understanding colon cancer progression. If colon cancer is diagnosed, it's essential to understand its stage. Staging helps determine the extent of the cancer's spread and guides treatment decisions. Stage 1 cancer is localized to the inner lining of the colon or rectum. Stage 2 indicates the cancer has spread beyond the inner lining to nearby tissues, but not to lymph nodes. Stage 3 means the cancer has spread to nearby lymph nodes, but not to other organs. Stage 4, the most advanced stage, signifies the cancer has metastasized or spread to distant organs, such as the liver or lungs. The stage of colon cancer at diagnosis significantly impacts the prognosis and treatment approach. Section 6. Fighting back. Treatment options for colon cancer. Treatment for colon cancer varies depending on the stage, location, and characteristics of the cancer, as well as the patient's overall health. Surgery is often the primary treatment for early-stage colon cancer. It involves removing the cancerous tumor and surrounding tissues, and sometimes nearby lymph nodes. Radiation therapy uses high-energy rays to kill cancer cells and may be used before or after surgery to shrink tumors or destroy remaining cancer cells. Chemotherapy involves using drugs to kill cancer cells and is often used after surgery to lower the risk of recurrence or to treat cancer that has spread. Targeted therapy uses drugs that specifically target cancer cells, while immunotherapy helps the body's immune system fight cancer. Section 7. Hope in the numbers, survival rates, and early detection. The good news is that colon cancer is highly treatable, especially when detected early. The 5-year survival rate for localized colon cancer, meaning it hasn't spread outside the colon or rectum, is around 90%. However, this rate drops significantly as the cancer progresses to later stages. This emphasizes the importance of early detection through regular screenings. When colon cancer is found early, before it has a chance to spread, treatment is more likely to be successful. It's essential to understand that survival rates are just estimates, and individual outcomes can vary based on a range of factors. Section 8. The genetics factor, inherited risks and predispositions. Genetics play a significant role in colon cancer risk. Inheriting certain gene mutations can substantially increase your chances of developing the disease. Lynch syndrome, the most common inherited colon cancer syndrome, is caused by mutations in genes responsible for DNA repair. People with Lynch syndrome have a higher risk of developing colon cancer and other cancers, often at a younger age. Familial adenomatous polyposis, or FAP, is another inherited syndrome that causes numerous polyps to develop in the colon and rectum, increasing the risk of colon cancer. If you have a family history of colon cancer or related cancers, especially at a young age, genetic testing can help determine if you have an inherited syndrome and guide screening and prevention strategies. Section 9. Lifestyle choices, fueling or fighting cancer. While you can't control your genes, you can significantly influence your colon cancer risk through lifestyle choices. Maintaining a healthy weight through diet and exercise is crucial. Obesity is linked to an increased risk of colon cancer and other cancers, while regular physical activity can lower your risk. A diet rich in fruits, vegetables, and whole grains provides fiber and antioxidants that can protect against colon cancer. Limiting red and processed meats is also essential, as high consumption has been linked to an increased risk. Smoking and heavy alcohol use are detrimental habits that can increase your chances of developing colon cancer and other health problems. Section 10. Polyps, tiny growths with big implications. Polyps are small, often benign growths that can develop on the inner lining of the colon or rectum. While most polyps are harmless, some types can develop into cancer over time. Adenomatous polyps, also known as adenomas, are considered precancerous. Removing these polyps during screening can effectively prevent colon cancer from developing. Regular screenings are essential for detecting and removing polyps, especially for people with risk factors such as a family history of colon cancer or polyps. The good news is that polyp removal is a routine procedure performed during a colonoscopy and can significantly reduce your risk of developing colon cancer. Section 11. Taking charge. Practical steps for prevention. Prevention is always better than cure, and there are several proactive steps you can take to lower your risk of colon cancer. Get screened regularly, starting at age 45 or earlier if you have risk factors. Talk to your doctor about the best screening options and schedule for you. Adopt a healthy lifestyle by maintaining a healthy weight, engaging in regular physical activity, and eating a balanced diet rich in fruits, vegetables, and whole grains. Limit red and processed meat consumption, quit smoking, and moderate alcohol intake. If you have a family history of colon cancer, talk to your doctor about genetic testing and personalized screening recommendations. By taking charge of your health and making informed choices, you can significantly reduce your risk of colon cancer. If you found this video helpful, please click like and subscribe for more informative videos. Stay healthy.